Hi, this is Scott Sicherer, Deputy Editor of the Journal of Allergy and Clinical Immunology in Practice, and I'm excited to present the highlights of our May 2022 issue where the theme is Eosinophilic Disorders. We thank our theme coordinators, James Lee and Amy Cleon, for coordinating this highly clinically informative theme issue and for contributing a theme editorial. It discusses the broad spectrum of eosinophilic disorders, and it contextualizes the reviews in this issue and the theme in general. There are 4 thematic review articles in this issue. The first is entitled Diagnosis and Management of Pediatric Hypereosinophilic Syndrome. The second is Eosinophilia Associated with Immune Deficiency. The third is on Drug-Induced Hypersensitivity Syndrome and Drug Reaction with Eosinophilia and Systemic Symptoms or DRESS, and it discusses clinical features and pathogenesis. These 3 articles come with CME opportunities. A 4th article is entitled The Potential Role of Biologics as First-Line Therapy in Eosinophilic Disorders. The issue includes a Quad-AI workgroup report entitled A Framework for Augmented Intelligence in Allergy and Immunology Practice and Research, a workgroup report of the Quad-AI Health Informatics Technology and Education Committee. There are 2 special articles. One is Electronic Inhaler Monitoring for Chronic Airway Disease Development and Application of a Multi-Dimensional Efficacy Framework, and the second is Global Variability in Administrative Approval Prescription Criteria for Biologic Therapy in Severe Asthma. In addition to original articles in this issue, we also have 8 clinical communications. Now I will present the summaries of the full-length original articles in this issue. These will cover the following areas: eosinophilic disorders, asthma, dermatitis, drug allergy, food allergy, immunodeficiency, immunotherapy, and mast cell disorders. So first we have an international retrospective study of off-label biologic use in the treatment of hypereosinophilic syndrome by Chen et al. What's already known about this topic? Hypereosinophilic syndrome, or HES, is a group of rare diseases with few treatment options. What does this article add to our knowledge? It provides retrospective data on the efficacy and safety of biologics for the treatment of HES. How does the study impact current management guidelines? Biologics may offer a safe alternative treatment for HES, and the clinical response may vary by HES subtype. Next, we have characteristics of dermatological patients with blood eosinophilia, a retrospective analysis of 453 patients by Radonjic-Hosli et al. What is already known about this topic? To make a differential diagnosis of dermatoses associated with blood or tissue eosinophilia is challenging because their manifestations are manifold. The underlying mechanisms causing eosinophilia are classified into intrinsic and reactive ones. What does the article add to our knowledge? A pattern analysis of demographic, clinical, and diagnostic test data of patients presenting with dermatoses associated with blood eosinophilia revealed an association of blood eosinophil levels with distinct clinical and diagnostic findings and corresponding diagnoses. How does the study impact current management guidelines? The results of the study will help to optimize the diagnostic workup of dermatologic patients presenting with blood eosinophilia and their therapeutic management. Next, we have Prospective Observational Study of Clinical Outcomes After Intravenous Magnesium for Moderate and Severe Acute Asthmatic Exacerbations in Children by Arnold et al. What's already known about this topic? Intravenous magnesium use for acute asthma exacerbations is increasing, yet there is limited knowledge regarding whether it improves outcomes. What does this article add to our knowledge? This research indicates that IV magnesium is associated with increased exacerbation severity, increased hospitalization, and no change in rate of exacerbation resolution among hospitalized children. How does the study impact current management guidelines? In the absence of data from a randomized controlled trial powered to examine important outcomes, there is insufficient evidence to support the use of IV magnesium for moderate and severe acute asthma exacerbations in children. Next, we have Asthma Daytime Symptoms Diary and Asthma Nighttime Symptoms Diary, Measurement Properties of Novel Patient-Reported Symptom Measures by Gator et al. What's already known about the topic? Despite the availability of various patient-reported outcome measures, the absence of a standardized measurement to evaluate asthma symptom severity has been acknowledged as a barrier to clinical research and understanding patient responses to treatment. How does the article add to our knowledge? The Asthma Daytime Symptom Diary and Asthma Nighttime Symptom Diary are new patient-reported outcome measures developed for adults and adolescents with asthma, qualified within Food and Drug Administration's Clinical Outcome Assessment Qualifications Program. Evidence supporting reliability and validity of Asthma Daytime Symptom Diary and Asthma Nighttime Symptom Diary scores is presented. How does the study impact current management guidelines? Findings from this quantitative study complement existing qualitative evidence supporting the validity of the Asthma Daytime Symptom Diary and Asthma Nighttime Symptom Diary as appropriate measures for evaluating the severity of asthma symptoms and the treatment benefit associated with therapeutic intervention. The next article is entitled Oscillometry and Asthma Control in Patients with and Without Fixed Airflow Obstruction by Coty et al. What's already known about the topic? Abnormal lung function despite effective asthma treatment is associated with greater symptom burden, exacerbations, and disease severity. Respiratory oscillometry measures peripheral airway changes that have been shown to influence asthma symptoms. What does the article add to our knowledge? Oscillometry, in particular reactance parameters, has a strong and consistent association with symptom control independent of the severity of airflow limitation. Abnormal oscillometry is sensitive in identifying poor asthma control. How does the study impact current management guidelines? This highlights the benefit of incorporating oscillometry into current clinical practice as a comprehensive assessment of the physiological changes that affect asthma control. The next article is entitled Association Between Asthma Control Trajectories in Preschoolers and Long-Term Asthma Control by Longo et al. What's already known about this topic? Over half of children with persistent asthma begin their disease course before age 3 years, but whether asthma control trajectory shortly after diagnosis in preschool is associated with long-term morbidity remains unclear. What does this article add to our knowledge? To our knowledge, this is the first study to show that suboptimal asthma control trajectories shortly after diagnosis in a large population-based sample of preschoolers were associated with unsatisfactory asthma control and higher healthcare use from childhood through adolescence. How does the study impact current management guidelines? The increasingly higher risks for asthma morbidity with worse asthma control trajectories after diagnosis suggest that optimizing control in preschool could potentially improve disease evolution, shifting from treatment to prevention of exacerbations in preschoolers with a new diagnosis. The next article is entitled Dupilumab Treatment Reduces Hospitalizations in Adults with Moderate to Severe Atopic Dermatitis by Silverberg et al. What's already known about the topic? Patients with atopic dermatitis, or AD, may require hospitalization for refractory disease flares or infections. What does the article add to our knowledge? Treatment with dupilumab significantly reduced the rate of all-cause and AD-related hospitalizations and reduced the duration of AD-related hospitalizations in a pooled analysis of 7 randomized controlled trials of dupilumab in adults with moderate to severe AD. How does this study impact current management guidelines? These data demonstrate treatment impact on a novel dimension of AD-associated morbidity. The next article is Safety, Outcomes, and Recommendations for Two-Step Outpatient Nonsteroidal Anti-Inflammatory Drug Challenges by Lee et al. What's already known about the topic? Drug challenge protocols to evaluate non-aspirin exacerbated respiratory disease-related nonsteroidal anti-inflammatory drug, that's NSAID, hypersensitivity, vary widely by provider and institution and can be prohibitively time and resource intensive. What does the article add to our knowledge? Two-step NSAID drug challenges are safe to perform in the outpatient setting after allergist evaluation. Most patients are then cleared for the use of at least one NSAID. How does this study impact current management guidelines? Nonsteroidal anti-inflammatory drugs are indicated for many common medical conditions, but therapeutic use can be limited by reported allergy. A simple two-step NSAID challenge protocol may be used in the outpatient setting to delabel appropriate candidates. The next article is Evolution of Combination Therapy with Etanercept and systemic corticosteroids for Stevens-Johnson syndrome and toxic epidermal necrolysis, a multi-center observational study by Zhang et al. What's already known about the topic? Stevens-Johnson syndrome, toxic epidermal necrolysis, otherwise SJS-TEN, are fatal severe cutaneous adverse reactions without consensus on the medical treatment. The use of systemic corticosteroids or intravenous immunoglobulin remains debatable. Tumor necrosis factor alpha, or TNF-alpha, inhibitors are potentially effective. What does this study add to our knowledge? Combination treatment with anti-TNF inhibitor Etanercept and corticosteroids for SJS-TEN may decrease mortality, skin healing time, and adverse events related to corticosteroids. How does the study impact current management guidelines? Co-administration of anti-TNF-alpha agents and systemic corticosteroids could be considered as an effective and safe treatment for patients with SJS-TEN. The next article. The indirect basophil activation test is a safe, reliable, and accessible tool to diagnose a peanut allergy in children, by Rinemans, Kortz et al. What is already known about the topic? The direct basophil activation test, BAT, is a reliable in vitro alternative to peanut oral food challenge. However, it requires fresh blood samples, and basophils unresponsive to Ig receptor mediated signaling reduces its efficacy. What does the article add to our knowledge? The indirect, or passive, BAT has a high diagnostic accuracy comparable to that of the direct BAT and can reduce the number of time-consuming, patient-unfriendly, and expensive oral food challenges required. It's not affected by non-responding basophils. How does this study impact current management? The indirect BAT enables a peanut allergy diagnosis to be made using a serum blood sample, which can be stored for a long time and transported to a central laboratory. The next article, Food Proteins in Human Breast Milk and Probability of Ig-Mediated Allergic Reactions in Children During Breastfeeding, a Systematic Review, by Gamarova et al. What's already known about the topic? Data from some case series and observational studies have suggested links between maternal diet during breastfeeding and potential symptom development in infants. However, data from double-blind placebo-controlled randomized trials are lacking. What does the article add to our knowledge? In the systematic review, we found that levels of food proteins in human milk were much lower than the eliciting dose for 1% of allergic individuals across the samples and studies. How does the study impact current management guidelines? The probability of an Ig-mediated allergic reaction in food allergic infants breastfed by a woman consuming the relevant food can be estimated as less than or equal to 1 in 1,000, which may impact approaches to management of children during breastfeeding. The next article is entitled Chronic Granulomatous Disease with Inflammatory Bowel Disease, Clinical Presentation, Treatment, and Outcomes from the US IDNet Registry, by Lebert et al. What's already known about the topic? A significant proportion of patients with chronic granulomatous disease, or CGD, have inflammatory bowel disease, or IBD. What does this article add to our knowledge? CGD patients with IBD may have more infections as compared to those without IBD, notably with enteric organisms. More CGD patients with IBD require immunomodulator treatment than CGD patients without IBD. How does this study impact current management guidelines? Early recognition and diagnosis of IBD in patients with CGD is crucial in order to decrease infectious complications. The next article is Morbidity, Mortality, and Therapeutics in Combined Immunodeficiency, Data from the US IDNet Registry, by Durkishak et al. What's already known about this topic? Identifying patients with combined immunodeficiency who require hematopoietic stem cell transplantation, as well as those with excess mortality, remain a clinical challenge. Previous studies have focused on case series of individual genetic diagnoses or are currently under prospective investigation. What does this article add to our knowledge? To date, this is the largest study of its kind to identify clinical factors that place patients with combined immunodeficiency at increased chance of either hematopoietic stem cell transplantation or mortality. How does the study impact current management guidelines? In this cohort of patients with combined immunodeficiency, specific genetic diagnoses and infection burden appear to impact the decision to undergo hematopoietic stem cell transplantation, while genetic diagnoses and invasive viral infections increase mortality regardless of hematopoietic stem cell transplantation status. The next article is entitled Efficacy and Safety of House Dust Mite Sublingual Immunotherapy Tablet in Allergic Asthma, a Systematic Review of Randomized Controlled Trials by Wangsa et al. What's already known about this topic? The Global Initiative for Asthma, or GINA, guideline recommends that house dust mite sublingual immunotherapy, abbreviated HDM-SLIT, could be considered in adults and adolescents with suboptimally controlled asthma and house dust mite allergic rhinitis, despite low to high dose inhaled corticosteroids. What does the article add to our knowledge? The HDM-SLIT tablets effectively reduced inhaled corticosteroid use in adults and adolescents with well to partly controlled mild to moderate allergic asthma. Adverse events were mainly local and anaphylaxis rarely occurred. However, the treatment effect in reducing asthma exacerbation in partly controlled moderate to severe asthma remains inconsistent and needs further studies. How does the study impact current management guidelines? The HDM-SLIT tablets, in addition to maintenance treatment, could be considered in adults and adolescents with well to partly controlled mild to moderate allergic asthma with a favorable safety profile. Our final article is entitled Effective Anti-SARS-CoV-2 Immune Response in Patients with Clonal Mast Cell Disorders by Rossignol et al. What is already known about this topic? Mast cells are key players in the Th2 immune response, but not the antiviral immune response. Data on antiviral responses, and especially responses against coronaviruses, in patients with clonal mast cell activation disorders has not been previously reported. What does this article add to our knowledge? In a comprehensive, prospective study, we did not observe any cases of severe coronavirus disease 2019 among groups of patients with clonal mast cell activation disorders. The patients showed effective anti-coronavirus immune response. Spontaneous interferon gamma release in the absence of T cell stimulation was observed frequently in patients with clonal mast cell activation disorders and was correlated with the basal tryptase level. How does this study impact current management guidelines? The observed spontaneous production of interferon gamma correlated with mast cell burden suggests that mast cells have a role in the antiviral immune response. The 4 patients with serial serologic measurements became seronegative over time. Hence, anti-severe acute respiratory syndrome coronavirus 2 vaccination after coronavirus disease 2019 is strongly recommended in patients with clonal mast cell activation disorders. This is Scott Sicherer. Thank you for listening to this Highlights podcast from this theme issue on eosinophilic disorders. I hope you enjoyed hearing these article highlights, and I encourage you to read through the entire theme issue, as editors are confident that the information is valuable to you and your patients. Thank you for listening.